All right, well, I'll just get started with a few housekeeping things first. You can have your cameras on or off, whatever you're most comfortable with. We do ask that you keep yourselves muted so it limits distractions throughout the presentation. Um, Feel free to ask questions in the chat, utilize the chat, and there will be time at the end to unmute yourself and ask any questions you have then. But my name is Allie Shipman. I am the Parent to Parent Program Coordinator here at the WVU And today you are all here for our virtual speaker series sessions, where today's session is Assistive Technology for People with Special Healthcare Needs. Here to discuss this topic are Doug Cumpston and Allie Morlock from the West Virginia Assistive Technology System, or WVATS. So welcome, Doug and Allie.
Thank you. Thank you.
I can go ahead and share my screen if that works for everyone.
Yeah.
All good?
Yep. Like Ali said, thank you for coming to today's training. It's going to be an assistive technology in you and a little overview about the WVATS program and how your state AT program can kind of help you when you guys hit any walls or barriers or maybe any resource uh, walls. Feel free to give us a call. That's kind of what we're going to talk about today. Feel free to ask questions as we go. That way, sometimes you might forget them at the end, but go ahead and ask them, and we'll pause. So we are, like I said, the state AT program. We are known as WVATS, West Virginia Assistive Technology System. Um, it's funny because WVATS, depending on what part of the state you come from, might sound a little different, but we do the same thing. We are WVATS, WVATS, however you want to say it. We are your state AT program. We love hearing all pronunciations, but we are housed at the Center for Excellence in Disabilities here at WVU in Morgantown. We are also under the umbrella of the Health Science Center, so that kind of gives us some more reach in the university to have them also backing us. So we also like to start out with just one big question. If everybody knows what assistive technology is, if you want to type stuff in chat, we can read a couple out loud, and then I think Allie will give you the definition that we use in our day to day. But if anybody wants to just show some participation and give us some answers, we always love those. So we have one saying speech generating device. Perfect. Yep, AAC. Again, these are great. These are what we do every day. So yeah, if you guys ever have questions, we are the ones to call. Go ahead, Ali, if you want to give them the definition and take over.
So the federal definition that's written into law, and this is our definition that we abide by, is any device or service used to perform tasks that would otherwise be difficult or impossible to do. We really like to highlight the word service in this definition because this can include a service animal, it can be having additional training done. It's kind of all encompassing. So anything that has to do with AT, so it's the device and the service that comes along with it. So we're going to go over briefly the different levels of assistive technology. Sorry, saw it in the chat here. But we categorize them into three different categories. So we have low tech, mid tech, and high tech. I would say high tech is something probably that you guys are all familiar with. You're going to recognize a lot more of the examples. But we categorize this just so we know where to start and what someone could maybe lead up to. So low tech, this is usually inexpensive. This is easily made, easy to learn, and readily available. So when we say readily available, we mean that you can find this at a box store or even at a gas station. The fidget spinners are everywhere in different fidgets. So you can go to Walmart, you could go to Target, and you can find these items. We have a picture of pencil grips. These are always at Walmart and Target during back to school time. These are a great simple tool that could benefit a student or even an adult that may need this accommodation. And then on the bottom, we do have PEX or picture exchange communication. So the individual would select the symbol that they would like to communicate with and then put it on the front of the binder. This is something that you can easily make. It's just Velcro, a small binder, and then just printing and cutting out and laminating the symbols. Next, we move into mid-tech. The price increases a little bit more. It may require some training. There's a specific or special design to the device, and then it may need a power source, meaning it might need to be plugged into the wall. It might require some batteries, but overall, it's still pretty easy to learn, but it also has a specific design. So it's kind of straightforward in the way that you're going to interact with it. So it might take some getting used to, it might be a little different from your day to day. Um, but on the top left, we have a magnifier. So this can be set on a table. You can zoom in and zoom out, change the color contrast that you need. And this is just a really great device. Some of them actually have text to speech. So it can take a screenshot of whatever is in front of it and then it can read it out loud. On the right-hand side, we have a B-Joy chin mouse. So if someone is quadriplegic, so they have no use in their arms or legs or anything like that, they can still get on the internet and navigate the internet just with their chin. It rests on their chin. They go to the right or to the left for their right and left click, and then that whole unit moves around so that they can literally use it as a mouse as they're scrolling along. And then on the bottom, we have a color contrast keyboard. This is black with white lettering. Someone might need that um, contrast so that they are better able to navigate the keyboard. This one is also a little bit larger, so it's not as small and tight as some of these other ones that we see. And this one would be plugged into the computer versus a Bluetooth keyboard. So now we'll move into high tech. This is probably the one that everyone is more familiar with or has seen or interacted with. These are much higher cost. There's specific training to learn the device or to have it personalized to you or customized. So on the top, we have a power wheelchair. Oftentimes, these are very specific to the individual. They have specific seating and backs and the different setups to where the individual can operate it independently. That's the main goal of assistive technology is keeping independence, or if you need a little bit of support, having majority independence. And then on the bottom, we have an AAC, which someone mentioned, or a speech generating device. It does look like a tablet. However, these devices are just set up to do the speech generating software. So they can't really surf the web. They can't add different apps. It can be very frustrating to some kiddos if they are utilizing an iPad because it looks so similar. But again, this only does the software for the speech. So we're going to talk about the process of acquiring assistive technology. So first steps, you might have interacted with assistive technology and you just didn't know it, or you have interacted with it and just didn't have the name. But we're going to assess the assistive technology needs. So you're positive that some intervention is needed, something is needed to support someone, or if they had something in place, they could be independent. So we want to look at the barriers that they're facing when they're completing activities of daily living. So we want to go throughout their entire day and see what barriers are they facing to where they have to have help with a task or they just are simply unable to do it by themselves. Assistive technology is sometimes specialized and needs special people to help. So bring in your professionals, occupational therapists, physical therapists, speech therapists, and your vision therapist, and then me, assistive technology specialist, and so many more. It's okay to ask your professionals for help if you're interacting with them, if you notice something is going on. They have a wealth of knowledge, so feel free to pick their brains and see what they would recommend. We work a lot in tandem with occupational therapists and physical therapists and speech therapists. They recommend something, and we have a lending library, which we'll dive into later. But we can allow the individuals and the family and caregivers to try it at home too to see if something is going to be a good fit and if they can go through the insurance process or even purchase out of pocket.
And I think Allie brings up a good point because please don't get discouraged if you call and we ask to talk to your speech therapist you're working with, or your physical therapist, or your OT. Just because we also aren't specialists in every device. So if you call and we ask, "Hey, what did your speech therapist say?" or your vision therapist, or your vision your doctor, we just want to get more information. That way we can find the exact right device that was going to work out for you.
Absolutely. So once we have identified a device, we've trialed it, we realize that this is a good fit. Um, this is sort of the next step. So we're going to acquire the device. We're going to get the device that we need. Things to keep in mind if there is a trial period that's needed to prove to either insurance or a funder that this device is a good fit. We again we'll go into it, but we do 30-day loans. So sometimes 30 days is the parameters that they need to see that this is a good fit, that you're interacting with the device, and that it has improved your quality of life. And then again, are you getting this device through insurance, or are you paying out of pocket? And then what about a device abandonment? This is a phrase that we use when someone gets a device, everybody's gung-ho, they're ready to use it, and it's just never used. That really sucks. Some of these devices are really expensive. So when they fall to the wayside, and they're just not utilized, it's kind of money wasted. So you never want to do that. You want to make sure that, you really have time with it, you're interacting with it, and it does fit all your needs. Um, when you ask insurance, or even if you are paying out of pocket, try to plan for 5 years of needed technology, especially if you're getting a power wheelchair or a speech communication device. If someone unfortunately has a progressive disease, and they're going to need more supports later on, you want to make sure that they're all there, because sometimes we just can't anticipate what somebody's needs are going to be. So they might need, eye gaze, so using their eyes to navigate their speech device. So having them interact with that early on, they can build up their stamina in their eyes, and they can be more comfortable utilizing their eyes with that device because they already know how to use it. For power wheelchairs, again, we have different seat options and leg rests and how the control is set up. So, kind of anticipating needs is what we're going to try and do. Um, some devices may require a training period. Please do not get discouraged. Extra time and training may be needed, and that's okay to ask for. This is an entirely new thing that you're implementing and you're trying. So if you get discouraged, we completely understand, but try not to give up, because you might just need a little extra time to learn everything, or you might just need additional training, and that's okay to ask your therapist for help with. Ask, us if you need it. We're happy to answer questions, but just give it a true trial period before we experience that device abandonment or switching things up. And then we highly encourage connect with other users through support groups or online forums, and then keep updates and upgrades in mind as things change. A lot of times with those communication devices, they suddenly aren't holding a charge, or they're doing crazy things when they just need an update. So just keeping things like that in mind, and being within support groups, it's really nice to speak with others that, may be going through something similar or have a similar device, so you can kind of get tips and tricks of how to keep up on the updates and upgrades, and also how to interact with that device long term.
We did have a question. How does one become an AT specialist?
Oh,
This one warms my heart because I don't think we've
yes.
ever been asked this.
No, I'll go first and I'll share a little bit of my background. I actually have my bachelor's degree in exercise physiology. So that kind of preps you for med school or, kind of going into healthcare more so. And then I did a total 180 and I have my master's in special education. And I actually was completing that when I started working here. I have personal life experience. I have a brother, he has autism. So I was very involved in IEP meetings and understanding how to advocate. And then it's just always been a sweet spot for me. Like I really just enjoy it and I love interacting. And I'm a fixer, I'm a problem solver. So this is sort of like marrying all the things of me. And for AT specialists, you kind of fall into the job. You just end up finding it and then you're here. And I've been here for 3 years, so highly recommend.
I will say another good place to start looking is put it Resna is the name of
Mhm.
the organization. They actually hold what's called the Assistive Technology Professional Certification. So that can happen at any time in somebody's journey. They can do it after college, before college. They lay out how many hours is needed, what degrees they prefer to certify. So that's a really good place to start as well. But it's coming. Ohio State is the only one that has an actual assistive technology certification right now. It's the only one of its kind. So I'm hoping more colleges come with it. I'm trying to urge WVU to maybe bring in a some kind of a certification for AT or something. Yeah. I will say about this slide before we leave this slide, when you're acquiring your high-tech devices like your AAC, we live in West Virginia, which is such a rural county with who knows how long you might be cut off from other people for various reasons. Have a low-tech backup. So if you get the big AAC device, have your low-tech communication board. If you get the big power chair and it's all decked out, you might not be able to charge it for a couple weeks and have a wheelchair backup. So always build these backups in place. If you get the high-tech device, always keep that low-tech around in case of emergency. God forbid a flood or something happen. But you want something that you can use in a pinch.
Absolutely. So now we'll delve into our WVATS lending library. Um, this is this is our bread and butter that we like to call it. But first, I'll give you some background information as to why we are a program, how we're a program. So the Assistive Technology Act of 2004, that's when it was reauthorized. The original was 19, I always mess up the numbers. When is it? 1970 something.
Yeah. 78, I believe, is actual.
Yes. Um, But it is a federal law that is designed to maximize the ability of people with disabilities to select, obtain, and actually use assistive technology. So this law created a system of federally funded state assistive technology programs to help their state have access to assistive tech to make informed decisions. So we are not the only program that is like this. There are ones in every single state and actually in the territories as well. So we all look very similar. We have similar functions. Some offer some different programming than us, but again, this is our main thing. We all have a lending library that we operate and lend items out to people. So again, this law just requires states to provide products and services that are designed to meet the needs of the individuals living within our state. Um, Individuals with disabilities, their families, caregivers, providers, and advocates are included as participants in the design of our program. And we do have an advisory council that we meet with every about 3-ish months. And there's advocates on there, there's state agency representatives, but there's also, AT users, day-to-day users, and we get to hear from them, you know, what's new on the market or what's going on that we should have our attention on. And also, is there changes that are going on at the state agency level that we need to know about and our other people and participants on the board need to know about. So it's a great time to just have discussions and see what everybody's up to, and then also let them know what our program is doing and if they have any recommendations or ideas for us. So this is our AT loan program. So we like to call it a try before you buy program. Um, Again, we want to find the best device that meets your individual needs or your kiddos, or, if you're a caregiver, that individual's needs. And we provide loans throughout the state. So we serve all 55 counties. Yes, we are located here in Morgantown. However, we serve all 55. Um, all loans are for 30 days, but we are happy to extend it for an additional for a full 60 days with that device. You just have to stay in contact with us. Just communicate with us. Let us know what's going on, what you need, if we need to swap devices out, if you would just like a little more time just to ensure that, it still is a good fit, or if you're waiting on funding, and you just, before you make that transition, just let us know. Or if you need it for a short-term accommodation, like if you have a surgery or an accident or something like that, and you can't be weight bearing for a little bit longer, just let us know. We're happy to extend it. We do have a website. It holds all of our items, and you can actually request all of your devices through that. If they are small enough, we can mail them to you, but we do have larger equipment like mobility items like those power wheelchairs, gait trainers, standers. So if you request something like that, we will coordinate and we will set up a pickup time and day.
I will say we've been becoming a lot more popular with the hospitals because hospitals have been setting up parameters for somebody to leave the hospital. So they're like, oh, I can't leave until I have a wheelchair in place. Well, the insurance company has to approve all that stuff, and you have to get it through insurance and get it to you. We had somebody who's like, hey, I'm supposed to leave the hospital at any time. I just need a wheelchair. So they literally come picked our wheelchair up, and then they were able to leave the hospital that day. So I think the hospital even came over and picked it up for them.
They
So
did.
yeah, things like that. Instead of spending that money and it's use the resources that you have available to you. I know a lot of people are like, I didn't know this existed, and that's fair. We love hearing that as well because it just shows what kind of areas we need to get to. But again, educated purchases, you know, and trying
Yeah.
stuff out.
I will say when you are navigating our website, we do house other lending libraries on there, but we do not manage them. So when you're looking at devices, you want to make sure that beside the name, it does say West Virginia Assistive Technology Program, or we'll talk about it next, our Pay It Forward program. And we'll go over that. But just keep an eye on that when you are requesting devices, because if you request them from another program, I can't tell you where if it is going to come or what to do with it. So we'll go over what kind of assistive technology is available in our lending library.
And I tell everybody, if you see something that is not on our website, let us know. We will buy it. We will put it in for you to try it out. We don't want that to be the end of your AT journey. Is we didn't see it, so we're done. Give us a call.
Absolutely. I think I mean, even just recently, we've gotten a color identifier for someone who is visually impaired so that they know what color their clothing is. They want to try it before they personally buy it out of pocket. We've gotten some larger mobility equipment as well, just to expand our library, but also to give more access to individuals to try it out and make sure, this is something I want to ask insurance for, or try to get the funds to purchase. So first category we'll talk about is mobility. So mobility is just your ability to move around easily. So on the left-hand side, we have a knee scooter. If you have surgery or break an ankle or a leg, you might use a knee scooter for a short time, but we do have those available. And then on the right-hand side, we have a standard manual wheelchair. Again, we also have those available. Any of the photos that we show, we have available in our lending library.
Mobility's been a big one for us. I think it's the one that most interacts and uses our Pay It Forward program. So people want to donate a mobility equipment to us. We get to refurbish it, repair it, and we get to give it back away for free. And this is mainly mobility. But just the generosity that comes from West Virginia has kind of really shown us. Thursday, I think we get to go pick up 8 power chairs that organizations donating to us. So we're going to repair, refurbish, and we're just going to give those power chairs back out.
Next, we'll go into daily living. So daily living is kind of a broad one, but this is assistive technology that can support activities like eating, dressing yourself, independently cooking, bathing, and much more. So things, that you have to do throughout your day, to take care of yourself. So it can be modified eating. So we have on the left, we have adaptive utensils. These have a better grip on them, so it's much more surface area for someone to hold on to if they might have some arthritis or just some dexterity issues in their hands. And then you can see that there's a slight turn to them. So it makes it easier for someone to bring that to their mouths without dropping the food, and they don't have to have as much wrist movement bringing that to their mouth. And then in the middle, we have a medication reminder. This one's really great for, I hate to say, older individuals. Sometimes they accidentally take double of their meds. This one just shows them the slot that they need for that alarm. So you can go ahead and you can actually lock it so they aren't able to turn it and they're not able to get into the other compartments. It just shows the one that they need for that one, and you can see if they've taken it or not. Um, then on the right hand side, this is called a Rift and Wave. It's actually a shower chair, but they have different bases for it. So you can just set this whole thing into the tub and it can lay low, or you can set it up on the stander and it elevates it a little bit. And then we also have a base where if you attach it, it actually has wheels on the bottom so that if you have a walk-in shower, you can actually put someone in there and wheel them into the shower more easily. Um, I want to say this category always brings up, we say the phrase, take care of the caregiver. So if you are a caregiver to someone, utilizing these devices is vital. If you throw your back out, if you injure yourself taking care of someone, you're out of commission. And that's not great. Who else is going to take care of them? Or, you have to get something in place very quickly. So making sure that you're utilizing things so it's less strain on you is really important.
And we had a perfect example come up with that Rift and Wave chair. We had a family down at our feeding and swallowing clinic, and the grandmother, she told us that she literally holds the grandson under the shower in with him and tries to wash him while holding him. And we're, oh, no, 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 please don't do that. Here's this chair. You can sit him in the chair and then bathe him. And her mind just like literally exploded. She's like, no way. We're like, yes, you don't have to try to hold your slippery grandchild and wash him. Because again, that's bad for her, bad for him. So the shower chair met all their needs. And again, she wouldn't even know it existed if she just didn't come down the hallway. So a lot of this stuff is we ask people, where are you having trouble? Like, where's your barrier? Like, is it as soon as you try to get out of bed? Is it trying to dress your, individual? That's what we kind of tell people to think about when they are looking to use or utilize AT is where's your barrier? Where's it come in?
Next, we'll talk about assistive tech for learning. Again, this can help with listening, math class, general organization throughout the day, memory, if you have some issues with that or just need some supports, and then reading and writing. So this is kind of where the IEP falls into place. And there is a section within the IEP that asks if the child needs assistive technology, and that's a check yes or check no. Sometimes a kiddo just needs some extra support, and that's okay. We're leveling the playing field for them when they're utilizing these. This isn't giving them a leg up. It's not really changing, how the task is completed too much, but it's still, allowing them to independently complete their work and understand it. On the left, we have a C pen. This is a reader pen or a scanning pen. You carry it across a line of text, and it will actually read it out loud to you. On this particular model, there is the dictionary feature, so someone could scan over the text or scan over the word, and then it will give a dictionary definition. There's also the feature of taking notes, so they can scan lines of text and it will save them, and then you can upload those into a document on the computer and have that as note taking. And then in the middle, we have a time tracker mini. So this is actually really great for transitions. So you can see it's green in the photo, but as time starts ticking down and you get closer to that alarm going off, it will turn yellow to indicate, time's getting low, we're getting to the end, and then it is red when time is up. So sometimes can just help kids with a visual or even adults, just have that visual perception of time. Sometimes it just doesn't translate. So understanding, green, I'm good, yellow, I'm getting low, and then red, I'm all done. We need to transition to the next activity. Then on the right-hand side, we have what's called a rocket book. It looks like a normal notebook, but when you take your writing, you actually take your phone and you scan the pages and it saves them in their app. And then you have those digital. So then you just take their cloth that they provide, put a little water on it, and wipe those pages down, and it's a reusable notebook. But again, it saves all your notes within the app. So you can go out throughout your entire day, taking your notes, and then at the end, upload all of them so you don't lose them. Sometimes people just need that digital aspect as well.
So we did have a question. Have you all ever presented school districts for professional development? Special ed teachers really need to know these items exist. Allie is the perfect person to ask because she has taken it upon herself to mail every school district materials and literature, fact sheets, anything they need. So if they say they've never heard of us, they're ignoring us.
Yes. I have mailed all 55 county special education directors. I've emailed them and mailed them information about our program. Thank you. We're trying. Again, with assistive technology, if you just aren't aware of it or if you're not well versed on it, it can be very daunting. It can be very scary. So I think, my biggest goal with interacting with them is just helping, any age or any, veteran age of teacher to learn what it is and, kind of stay on top of the up and coming devices that they might see within their classroom. We've heard unfortunate horror stories of people, the gym teacher being placed into the special education room, just to cover or, just to interact for a couple months. But, you know, if they're not aware of it, they're going to be resistant and it is change. I created a guide. If you ever want it, you feel free to request it. But it actually is tools for teachers and it goes over what assistive technology is, what they might encounter, how to interact with it, and so on. So, yeah.
Because
You-
for being at the university, we do have this neat perspective of we get to see some teachers before they leave the college, and we get to see some OTs before they leave the college. They're not getting a lot of AT either. So unless they specifically find us out or one of their professors find us out and we teach or talk to the class, are normally not getting this assistive technology before they leave college. So it kind of are getting the short end. So yeah, we're trying. And you guys can definitely help us out by also promoting us to your school district and say, hey, they might have sent you something. Double check.
yes. So next we'll go into assistive tech for low vision or blindness. Something like, okay, I'll answer this one. Something like the C Pen, is that the parents would pay for it? I think it would depend on the school district. I think we have seen in the past the school district wants to trial the device with the student to see, and then if it gets written into the IEP, the school will typically pay for it. If there's some friction there, sometimes parents will pay out of pocket for them and then allow the school to use them.
Yeah, I
So
think Allie's right. If it's in the IEP, it's on the school. If you don't get it written into the IEP, it's kind of on you.
I hope that answered your question. So low vision and blindness, there all are different tools that support just accessing information, navigating their environments, and navigating the internet as well, and performing daily activities. So um, I will say, if you have ever interacted with someone that is blind or low vision, they have a lot of little things that they do that helps them get, throughout their day. But they're so adaptive and they come up with really awesome little strategies to use. And I feel like I learn something every time that we attend like a Blind Unity Community Day by the National Federation of the Blind. I'm just baffled by, little things that they come up with. But on the left-hand side, we have that magnifier again. We have different sizes of these. So, can be something small and handheld, or it could be something larger, sort of like that, but they are a little bit larger, that can set on a table and they can interact with it that way. And then on the right-hand side, this is a human wear Braille note taker, and Braille display. So someone can actually take notes using this, and then they can upload them onto the computer later, or they can upload files into that, and then they can go along and read it, and it'll pop up in Braille for them to interact with. So for hearing, again, you're just accessing sounds, maybe being able to communicate a little more effectively, and then participate in daily activities if they are hard of hearing. So sometimes, just taking a phone call, or, and understanding what's going on, or, just amplifying the world around them to where they can hear the conversation that's going on and interact and partake. So on the left, we have a caption phone. So in real time, this phone will capture the conversation and give them captions as it scrolls along. So they're not going to miss any part of the conversation, and it is in real time. So there's no lag or delay when they're interacting. In the middle, we have something that's called a pocket talker. You plug in headphones. It could be, earbuds, or it can be over the ear headphones. But the little black microphone on there amplifies the entire room. So this is great if you're interacting, with a couple people. But if you're out, at a conference, or if even in a restaurant, it's going to pick up every single sound. So it can be very overwhelming. And we really recommend just keeping them in small, intimate settings where it's not going to capture a lot of feedback. On the right-hand side, we have what's called a UB Duo. So it does have another screen attached to the other side. It kind of looks like Battleship with their setup. But this device is really awesome. It can be considered a communication device, but it does not go on Wi-Fi. It doesn't use any internet. It's just simply radio waves in the way that it interacts. So it does type in real time, so you can see what the other person's saying. So this would be great for, doctor's appointments. If someone is hard of hearing, they can still get information needed. It could be HIPAA, but it doesn't save anything. So this device is great. Once you delete it, backspace, or once you turn them off, none of the information that was typed in there is saved. It's gone forever. So I actually know the local DMV here in town actually has one of these devices. The DMV is loud. It can be overwhelming. If you are hard of hearing, or, your speech is impaired, this is a great device to utilize. You can still communicate, you can still type it out, and you can understand each other really easily. So AT for communication, this is one of my favorite categories. A little biased, but I absolutely love communication, because again, you're allowing the individual to express their wants and their needs, interact with others, and partake in conversations. And then having access to this allows them to participate within their community, within their schools, and just their daily lives. A lot of times in schools, there's a frustration, and, there's some behaviors. But when they don't have access to expressing their wants and needs, you're going to be frustrated too. If you can't tell someone, I just want a sip of water, you're going to get really frustrated because your needs just aren't met. Um, so on the left-hand side, we have something that we would consider mid-tech communication. So it's called a quick talker. You have these different sheets or levels that we call them. You would change whatever page you need, and then you would click the picture that you want, and it would speak out loud. So you have to record all these messages. So I hope you like the sound of your voice, or whoever's voice is going to be on there, because it is not pre-recorded. It is someone else's voice. And then in the middle, this is what we have. It's called a Tobii Dynavox. This is that high-tech tablet-looking device. But again, it just has that speech software. And then on the right-hand side, we have the picture exchange communication. They call it PECs, but now it's, again, just exchanging those pictures to express their wants and needs. So sometimes it's symbols, and then sometimes it's actual photos of things. And these can be great for a daily schedule as well. So having an understanding of what their day is going to look like, where they're going, things of that nature.
And I think Allie was sorry when she was saying that communication is a big one. This is the one I think our schools kind of get messed up the most with. They treat it like a device and not like the child's voice. If a kid's sitting there pressing his device and saying something over and over again, that's the same as a kid talking in class. Like you have to treat that as the same. You're not going to cover a kid's mouth. You're not going to take the kid's device away. So, and that's kind of where we see some of the communication and need our just speaking with our children's schools or our teachers is just making sure that they know that device is theirs. They can't take it away because that's their voice, and just making them aware of how that should be interacted with.
So I'll answer the question in the chat. It's are hearing aids an available item or financial assistance with purchasing? So hearing aids we do not offer in our lending library. Hearing aids are very specific to your type of hearing loss. So we recommend if you need or if you think you need or someone else needs hearing aids that you go and get a hearing test done so that you can know, where your hearing loss is at, what your hearing level is. And then if you are needing us financial assistance, we have some resources that we can send you for you to pursue on your own. But then, otherwise it's hard to have just general things in there because they just might not be a good fit for the hearing loss that has occurred. Um, oh, someone responded in there, so we'll move on. So AT for recreation. So everybody has hobbies and they have things that they like to do. You might like go hiking or you might like gardening, or biking, things like that. Um, Individuals that have differences or, a disability, they should have access to that as well. So, these pieces of AT allow them to interact with that and have leisure and recreational activities. We can adapt sports, we can adapt video games and games, different outdoor activities, just so that they can have enjoyment as well and have a little joy in their lives. On the left-hand side, we have a Riften tricycle. These have many different features that you can get on them. You can have to where the individual is able to pedal and steer and be independent, or if you have a kiddo that's still learning, you can have it where the parent on the back can steer and kind of brake and things like that. We do have these available to loan. They are a great thing. Everybody loves to get them in the summer because, kiddos like to go out and bike, and have fun in their neighborhoods, and everyone should have access to that. So these are awesome, and Riften's a good company to work with if you ever get the chance. In the middle, we have an Xbox controller. On the back, there is actually 17 different ports for switches to plug into. So someone that is in a wheelchair or, can't interact with a typical controller, this is a great option for them. They have those two big buttons as well on there that they can utilize, or they can have their own entire setup. They can utilize their feet or their hands, elbows, whatever that they can interact with that switch with, it can be set up that way. And then on the right-hand side, we have the ergonomic gardening tools. This is great for individuals that might have arthritis, or just have some dexterity issues in their hands. This is low strain, so they can still complete acts of gardening, and do it with enjoyment and not be in pain.
I like this one because we get a lot of calls. Hey, my son is blind, or my loved one is blind. What can they do? And we always like, hold on, back up. What do they want to do? There's been many times where we've set up AT on somebody else's behalf at the request of somebody else, and they don't want to do that at all. We worked with an individual, tried to get him all this computer access set up so he can access the internet, and then once he did, he was like, I just want to go outside. I don't want to get on the internet. So again, like we said, speak with the individual. We don't want AT to be abandoned. So make sure what AT you're working to match with individual is the AT they even want to be matched with. Yeah. It's just, yeah, one of those things like make sure it's the same recreation that they're trying to participate in.
So next we'll talk about computer access. It can allow the individual to navigate, communicate, and perform tasks independently in the digital environment. So it's more accessible and functional for them. I will say, Doug always brings up a good point. During COVID, this was a really big game changer. We all, were sent home. We had to work from home. Um, an individual with a disability already had these accommodations in place. They already were able to do this. So they had more access to, just that human interaction. Um, and so this is something that, a lot of people don't think about or they think is going to be really hard to access, but computer access, we got a lot of bells and whistles for you to trial out before you give up on navigating the internet. So on the left, we have what's called a Kinder keyboard. This is something that has the vowels in a different color than the consonants and the punctuation marks in a different color. So this is great for kids or, just anyone that's learning the different things and need that distinction on the keyboard. It is larger, so it's easier to press the buttons and not accidentally hit something that you don't want. In the middle, we have that chin mouse again. Again, the right and left click, and then you can move it all around like a mouse. And then on the right, we have dragon dictation. You've probably seen commercials for this over the last couple of years, but it is speech to text. So as you speak and dictate, it pops up onto the document that you're working with, and over time it learns, your tone, your different phrasing, things like that. It gets more individualized to you and custom. Um, but this is a great tool. We're seeing this a lot more, not Dragon per se, but text to speech and speech to text within the schools and people utilizing it just because it's an easier way to access the information for them. So next we'll go into environmental adaptations. It is sort of what you're thinking. It just helps you interact with your surroundings and do it safely and accessibly. So it can be in your home, in your workplace, or just in community settings out and about. So on the left we have, it's called a curtain bot. So, pushing open and closing your curtains throughout the day can be difficult depending, on how high they are, what the material is, how the rod is. So having these is awesome. It is operated by an app. You place these little bots on there, and you can select for them to open, and it will crawl over and push the hangers aside, or you can close them and it will push the other way. Um, in the middle, we have what's called it's a threshold ramp, or, we have something called portable ramps that go up to 12 feet. And sometimes you just need these to get into a place easier, or if there's a step that is just too much, these can help cross that barrier. I will say we do have ramps available for loan. However, for every inch of height in your step or in, multiple steps, that equals a foot out for your ramp. So if you have 12 inches, you have a 12-foot ramp. If you have anything over that, typically, you're looking at potentially constructing your own ramp or, getting a ramp put in place just so that the slope is safe for someone to interact with, and it's just in general safe. And then on the right-hand side, we have what's called a power link device. You plug in a switch and then you plug in a lamp or anything that has a plug, and you can have different settings on this. You can have it a latch, so once you hit the button, it turns the lamp on. Hit it again, it turns it off, or you can have a timer. So once you turn it on, it can stay on for 30 minutes and then it shuts off automatically. It's really just what you need and how you need to interact with something.
And this is the assistive technology that kind of sneaks up on people. This is the stuff that you interact with every day and you didn't know that you were interacting with it. So these are your curb cutouts on the sidewalk. These are your automatic door openers when you walk into a grocery store. These were all stuff that people had built for people with disabilities, but it's great for everybody. This is where your universal design comes in. And as we get closer to people building for universal design, it's going to get better for everybody to interact with their environment.
So, after we've talked about all these different categories and assistive technology as a whole, who do you think could benefit the most from assistive tech? And feel free to say it out loud or type it in the chat. Yes, everyone. You might be using AT and you just didn't realize it. If you wear glasses, you're using AT, they're helping you see. Um, I know a lot of things in the kitchen you might be utilizing, and they started off for someone, a loved one made it for them, and then it got popular and hit the mainstream, and now it's more affordable and everybody has one, like automatic jar openers. Those are great. Um, but yeah, overall, everyone can benefit from it, disability or not, short-term, long-term accommodation, whatever. Um, Sometimes you just use it so it's less wear and tear on your body. I can't open up a jar by myself. So I use a jar opener at my house. And then also I'm only 5'3", so I can't reach things on the shelf all the time. So my husband, when he comes in, he's like, "Why are all the things pushed forward?" I accommodated myself and I push the things forward so I can reach them more easily. So it's little things like that to just make it easier on yourself and less strain. So next we'll go over some other services that we provide as a program. So, like Doug mentioned earlier, we do have our Pay It Forward program. So, we take donated devices and equipment, we refurbish them, clean them, purchase any missing parts that are needed, and then we give them back out to the community and families in need. It gives these families and individuals access to AT that they might not have been able to have access to. A lot of times we get wheelchairs, like he mentioned, mobility items, or gait trainers and standers for it typically tends to be for children. Insurance makes you pick between a wheelchair or a gait trainer or stander. You're gonna pick the wheelchair because that's what they're in the majority of the time. That's how you transport. That's how, that's what they're in. So getting access to a gait trainer or stander is awesome. When people donate these, we're always really excited because that gives that child or that individual another positioning chance so that they're not going to get, sores or they can build up some muscle and stamina. But this is a really great program and it's really opened up some doors for some families across the state.
And I think this is where the AT program shined because I think it was I want to say 24. I think 24 all AT programs, all 50 states and territories was funded at something like $38 million from the government. We were able to show the government that we turned that 38 million into somewhere around 70 million in savings for families. And this is a big part of that is people not just junking their devices or throwing them away. It's they're making sure that they can find another home for them. And we were definitely, said show that we almost doubled their government's money and they really like that.
So next we offer evaluations. These are an hour long and they are held in Morgantown at our offices at the CED. There's no official documentation provided during this time. We just send an email follow-up that goes over what we went over during that meeting, what devices were shown. But during that evaluation clinic time, we can do troubleshooting. Oh my gosh, troubleshooting for the current AT that you're using. If you're just having some issues, if it's just not working right. In-person demonstrations of AT. So if you're kind of in between two products and you just aren't sure which one you want to go with, we can show you how each work. And then you can kind of go from there. If you have a particular task, we can just do a general AT evaluation. So we'll get some information from you, and then we pick devices and we will demonstrate them to you, allow you to interact with them, and then you can kind of, borrow them on your own after that. And then we do offer training sessions with AT. So if you just need some extra time, or if you're unsure of certain things, we can just go over the device you have, or if you're looking to get a new device, show you some different background information and let you interact with it. So we do offer assessments. These are different from our evaluations. This is our only fee for service. So we unfortunately have to be paid if we do this. This is just to cover travel. West Virginia is small, but it is mighty in the length of time that it takes to travel across the state. So it's really just to cover travel cost. So, but we will travel to the environment that is providing barriers for the individual. So that can be a workplace, that can be school. We have not done a home one, but maybe in time. But we observe during the assessment. But we do bring along assistive tech to kind of trial during that time, see how it interacts with the individual, if it works in that environment, if it's just a good fit at all. And then after we do that initial visit, we do create a formal assessment document and we provide that to you. You can use that document to support in an IEP or 504 accommodation, or it could be for workplace accommodations as well. So that's an official document that, belongs to you that we fill out and provide.
And most of the time, the ones we have done, the schools have paid for them.
Yes. So we do offer information and assistance. We take your calls, we take your emails. We'll provide, information about our program, about different devices, or if you're looking for resources, we will try our best to gather as many as we can and send them to you. That includes financial resources, for you to pursue on your own. But this is our information, so feel free to contact us if you just want to know more, or if you have questions, things like that. We're always happy to answer your calls and your emails. We do have social media. We are on Facebook, Instagram, and TikTok. Every Thursday, Sophia posts a Tech Thursday. So she actually goes over different devices that we have available or different features within. She just did Android and Apple accessibility features that are built into phones. Um, Soon she'll be doing some holiday themed postings, but if there's anything you want to see, we can work that into our schedule and do a demonstration of the devices. But again, thank you for your time. Thank you for attending. We really appreciate it. And hopefully you learned a little bit about us and what we can do to help you.
Yep. And Allie Shipman added that her son had a sports injury and she was able to come and borrow stuff from WVATS. And that's what we try to be for people in the state, because that's such a hard time. I mean, if you have a loved one that is in in need, you want to be there for them. You don't have to be thinking about, oh, is insurance going to pay for this? What do I have to do to get this? Is this going to cost me more money? And that's kind of where WIVATS comes. Is we take all that guesswork away. Just tell us what you need, and we get it to you. So don't feel bad to reach out. That's kind of what we do.
Absolutely. I'll talk your ear off about AT all day. I love
Yeah.
it.
So if anybody has any questions about anything that we missed, feel free to ask. If not, you can feel free to send us an email. We'll make it more personalized if you have a question that you want to save for us.
Yeah, like I said, it is really a great program. I have utilized it too. But if you have any questions, go ahead and reach out to them. You can reach out to me and I can forward it to them. Um, but if there's no other questions right now, our next virtual speaker series is all about Birth to Three, and that is on December 4th at 11 o'clock. And I will put my email in the chat too. All right, well, thank you everybody for coming, and I hope you have a great day.
Thank you.